Pain management. Pain, firstly, can be defined as an unpleasant sensory and emotional experience which can be associated with actual or potential tissue damage. So, regarding pain, there can be various causes of pain. So, firstly, we can see about what are the causes of pain. It can be an injury, direct injury. It can be a surgical operation or a surgical intervention in the patient or in the person. It can be an infection. It can be violence, or it can be any other systemic diseases, or also lastly it can be a psychological problem also. There can be various types of pain depending upon the firstly when we can divide the pain on the basis of duration. So if a pain has an immediate or short duration of onset, then it can be called as acute pain. Or if a pain has a longer course or long duration of onset, that is it has been for more than 3 months or more than, we can call it as a chronic pain. Second, it can be classified on the basis of the location of the pain, that is whether it is caused by any injury of nervous system, that can be called as neuroleptic pain, or if it is has any social or emotional changes, for example psychogenic cause, like for example headache. It can also be based on the or divided on the basis of its severity, that is it can be mild, moderate or severe pain. We can have a type of scale that we can ask the patient that on a scale of 1 to 10 how much he or she is feeling regarding pain. Also, it can be on the basis of physical sources, that is whether the source of pain is superficial, that is pain in the skin, or it is a deep tissue pain, that is due to damage of tissue, or there is any visceral or cavity pain. There are various methods of pain assessment, as I told earlier, that is first it can be a pain scale method, that is we can identify that whether the pain has, what is the value of pain on the scale of 1 to 10, or whether it is discomforting for the patient at what level. It can also be a face reading scale method, whether the face of the patient, of how he or she expresses her emotion in response to pain can also be used to scale the pain. Also, there can be a questionnaire method that you can ask the patient by asking the method of pain. Now coming to the main measurement of the pain, that after identifying the type of pain, what should we do? So we can provide with analgesic drugs. For example, there can be NSAIDs for mild pain. For moderate pain we can use some drugs for example tramadol, and for severe pain we can use drugs like morphine, etc. Depending upon the severity of pain, that is step 1, then we can use, as I told earlier, that we can use non-opioid medications, for example paracetamol and NSAIDs. Step 2, as we told, that there are weak opioids such as codeine and tramadol, which have multiple mechanism of actions, and the third one being strong opioids, which includes morphine or oxycodone, fentanyl and bupropion. So there are following agents. Apart from that, there can be some adjuvants which can be used with the analgesic medications or separately to manage type of neuropathic pains, which the example can be TCA drugs, example amitriptyline, SNRI antidepressant, for example duloxetine, anticonvulsants like gabapentin or pregabalin, but also these drugs come with a side effect. For example, in NSAIDs we can have gastritis or stomach ulcers. Also, for example, in the opioids we can have skin itching, constipation and altered mental state or sedation if taken in very high doses. For example, if there is a surgical procedure happening in a patient, and if the patient had a major trauma during surgery, or even the surgery was very good and went on properly, but there can be possibility that patient is having pain, so we can use the drugs in form of IV or oral as required. If the patient has recovered from the surgery in a very brief time, then we can use IV medications, and later on if the pain becomes more bearable, we can switch to drugs in oral form. For example, then NSAIDs like diclofenac or can be used, etc. Also, the use of opioids in palliative care is also an important point, where there are two types of dosing. For example, the first being a background opioid dosing, which is a 12-hourly modified release of oral morphine, or second being rescue doses or for breakthrough brain, which are used in between the background opioids for relieving the pain which occur up in between a long period of time. And these rescue doses are about 1/6 of the background doses of a whole 24-hour. And in this way we can be also the post-operative analgesia. The purpose of the post-operative analgesia is that they encourage the patient to mobilize quickly, and also helps to have an adequate oral intake, because patients can have pain while having oral intake, having medications or having food. If they are in pain, they can't take food properly, so these medications help in a way that they can easily resume their activity as early as possible.